Today we're going to learn about the cervical plexus. There's a motor component and sensory component, and for ease I draw the motor component on the left and the sensory on the right. So to start the drawing, I draw 4.5 arrowheads and then label them C1, 2, 3, 4. I don't normally label 5 because that's not actually part of it, but I keep it there just for the motor part. So starting from the motor side, then I draw ansa cervicalis. That has roots from C1, 2, 3, and this one supplies 3 main muscles: the omohyoid, the sternohyoid, and the sternothyroid muscles. There's also part of C1 that descends alongside, like the hypoglossal nerve, and that supplies geniohyoid and thyrohyoid. So often put in the hypoglossal nerve there too. So this is the motor side. And then just to be aware, the phrenic nerve comes from C3, 4 and 5. 3, 4, 5, keep the diaphragm alive. So if you did a deep cervical plexus block, then you can paralyze the phrenic nerve. So bilateral deep blocks may paralyze both phrenic nerves and cause respiratory disturbance. So then looking at the sensory side, this is what's relevant in anaesthesia for neck surgery. So for example, people may do a superficial cervical plexus block for something like a carotid endarterectomy. I use them for parathyroidectomies as well. So here you have the lesser occipital nerve from C2. You have 2 that come from C2, 3. So you have transverse cervicalis and the greater auricular. And then from C3, 4, you have the supraclavicular nerve. So the supraclavicular nerve has 3 main parts: the medial, intermediate and lateral parts. So I draw it as 3 parts. And that's pretty much the easiest way to learn the cervical plexus.